that. Well, today, as I said, Freedom Village, we have on Joel Niblett, who has been with us several times. He's the administrator there. And I'd also like to welcome Dr. Mazar Zamani, who we know here. He's been by on our show a few times, so it's good to see you again, sir, as well. Freedom Village, right up the street, up there on El Toro. And one thing I think that differentiates you folks is that you really have a different levels of care there, from somebody who maybe is very self-sufficient, and that's just the place they want to go and end up living and having their meals and all that sort of thing, to people who need different kinds of levels of care and even therapy, right?
That is correct. And Freedom Village is a continuing care retirement community. So we do provide all three levels of care, which is independent living, assisted living, and skilled nursing. And in the healthcare center, we have the assisted living and the skilled nursing. So that's where we always want to make sure that everyone's aware that we're at the healthcare center, open to the public. The independent living is we invite people to come in and take tours and visit and get to know us, and then from there decide whether or not they want to become part of the Freedom Village family. And if so, then we take care and manage them for life through the whole continuum of care as needed.
So if they may start out there independent living, and it would be nice, hopefully they stay independent living as long as possible, but if need be, they can move over, transition into the healthcare portion, correct?
Yes, that is correct. And I always encourage people to not wait until you need the services at the healthcare center to consider moving in through the independent living. The most promising aspect of enjoying a greater quality of life in a community like ours is making the decision to move to independent living when you're able to, when you can have quality of life, do all the recreational programs, go on the trips, do all those things, and at the same time, in the back of your mind, have the peace of mind knowing that you have the healthcare center available to you 24/7, and the assisted living, skilled nursing, and then have prominent physicians in our community like Dr. Zamani overseeing the care through the healthcare center.
Yeah, definitely. It's a very good way to look at it. Dr. Zamani, as I said, you've been on. We've been over here on Channel 6 a few times before. Good to have you here again. Tell us a little bit about yourself, and I know that you've worked within the senior community for quite a while, right?
Yes, sir. It's been about 16 going on 17 years here in Laguna Hills. Mostly a solo background, but now I've joined Saddleback Medical Group, a strong group of 28 physicians, and as of about half a year ago, I'm now the medical director over at Freedom Village, working with Joel very closely, providing senior care. Most of my patients are seniors, although I do have some younger patients too, and really enjoy serving that population.
Yeah, well, it's great that you're on board
Thank
with
you.
Freedom Village. And the type of programs that you offer there at the healthcare center, I know there's the Bridge to Home, which really are for people who may only need that facility for a short amount of time, right? Maybe going through therapy.
That is correct. It's post-therapy. And really the reality is Dr. Zamani is the premier physician, one of the premier physicians at Saddleback Hospital. And even though we have Dr. Haga, who was the skilled nursing medical director, he's now in the independent living and assisted living, but we need the expertise of Dr. Zamani. And he is very resourceful, and at the same time he holds to the same value system of what and how we perceive care should be in long-term care. So we're proud to be partners with Dr. Zamani. In terms of the type of services that we provide in the healthcare center, post-acute care means whether it is an event that's taking place that was unexpected and you go to the hospital or you have a planned knee or hip surgery, ultimately you're going to end back up in skilled nursing. When you come through skilled nursing, that's where we're going to take care of you, manage your therapy. When that period has ended, where you now have plateaued, in other words, you've regained your strength and you're able to walk as independently as possibly as you can, then we graduate you to our assisted living through a program called our Bridge to Home program. So it's very unique to South Orange County, and we can offer this program because we are a continuing care retirement community. A lot of places cannot offer that. So we actually have a lot of referrals from other skilled nursings in South Orange County, as well as they come from a lot of other different unique venues to join us in a respite program in our assisted living also. So we're very proud of that program. It's been very successful for us, and we always want to make sure everyone's aware that that's the type of service, one of the unique services that we can provide to everyone at Laguna Woods.
Yeah, and I think that's really great. You even offer private rooms and all, right?
We do. A lot of skilled nursings as well as assisted livings have private rooms, but our skilled nursing private rooms, in fact, all of our rooms in our skilled nursings, they all have private restrooms. Our 4 private rooms that we have, it's like a birthing room where there's the leather couch. It's a very comfortable environment, and we try our very best to attract and invite people into these rooms by appealing to all the senses, the visual, the sight, the sound. So it's not just the aesthetics. And the actual hands-on care obviously is warm, friendly, sensitive, empathetic to what the person's going through. And we also make a real strong effort to reach out to the families, because it's the families that are equally, concerned, and they're struggling with how's mom going to do, or what's dad going to do, post this time. So we're working and kind of walking through this process and this journey with them to help them decide where they're going to land, and then we utilize the physicians like Dr. Zamani to help us coordinate that.
Yeah, and this time of the year, of course, holidays, people are visiting, and also as we get, I guess we're kind of into flu season. I think so far this year, things have been pretty good in as far as the flu season goes. There hasn't been any major outbreaks so far, but it's something that you have to keep tabs on, right?
Yes, sir. So there's been a mild season so far, probably because the flu vaccine this year, especially to the seniors, has been advocated to be a high-dose flu vaccine. And as you know, every year we have a different formulation and varying success with those formulations. This year seems like the nail's been hit on the head, and owing to the physician and their staff's aggressive administration of these vaccines to the vulnerable population. If I may just give a quick little tip to how to avoid flu, the cold, and most of these viruses, and the key relies in that they are all respiratory viruses. They're not skin viruses, they're not touch viruses, they're respiratory viruses. So they need to grow in your respiratory system, and your respiratory system starts at your nose and ends at the bottom of the lungs. So if you can prevent allowing these viruses to land on your eyes and your nose, you essentially are going to be virus-free. So washing hands and all that is wonderful, but just try not to touch the face, try not to touch the eyes, and you'll avoid most of these illnesses year-round.
Yeah, that's definitely a good tip. As far as Freedom Village goes, you have a Medicare 5-star rating, right?
We do, absolutely, and we're very proud of achieving that goal. And as far as I know, we're the only one in South Orange County that has achieved that goal. But my hopes are that everyone in South Orange County can achieve that. The reason why is because the Medicare 5-star component is built on really 3 pillars. One is the past and historical survey inspections from Department of Public Health. 2 is the staffing models, and 3 is the quality of care components. So to achieve that, you have to have a 5 in each category to get an average of 5, obviously, and that just doesn't happen. We have worked very diligently to accomplish that, and as I've mentioned in the past, this is not an isolated method of achieving it. We need to partner with people like Dr. Zamani. We need to partner with Saddleback Hospital, with Louise Delabella, who's the case manager, to make sure that we're admitting and working with them closely, with Memorial Care, to make sure that we're partnering with all of the resources that they have to achieve this goal.
Right.
There's many other physicians in the community that we attribute this to. Dr. Dabatabai, he's a prominent physician, as well as other key, what they refer to as SNFists. So they're physicians that move amongst the skilled nursing world, that partner with providers like us to achieve that. So that really is credit to everyone working together in concert to achieve that. But by no means is it just Freedom Village. So So I just want to make sure that that's clear and that, that everyone's aware. We need to have those relationships to make us and continue to be successful in the way that we are.
All right, that's really wonderful, and you know, you've come on our show over the years, and it's great to see how well Freedom Village, the ratings that you get, but the continuing care program that you have, the Bridge to Home, and just the independent living is a great place. So I want to thank you for coming on. Nice to see you again, sir.
Thank you very much.
And
Thanks for
Freedom
having me.
Village, they're right up the street. They're up and off El Toro there in Lake Forest, not far away. And someone wants to call and just maybe they're just to schedule a visit and take a look, they can certainly do that, right?
Yeah, they can just call and set up an appointment or just walk in. They don't need
Okay.
to have an appointment. They
Very
can just
good.
show up, walk into independent living, or walk into the health center, ask for Joel. I'd be glad to walk them around and give them a personal tour. That's no
Very
problem.
good.
So anytime that's convenient for them, we welcome them to come and
All right.
visit us.
And the number was on the screen there, 949-472-4733. Thank you. Nice to see you gentlemen again. Happy holidays to you.
Thank
We'll
you.
be right back.
Thank you.
Freedom Village Skilled Nursing offers rehabilitation after surgery with our team of on-site therapy professionals. Our quality care measures are recognized by Medicare with a 5-star rating. We support you with your recovery with a caring staff and registered nurses around the clock. Freedom Village Skilled Nursing is conveniently located near 3 hospitals, open to the public, and offers private Serenity suites. Call today to see our 5-star difference for you or your loved one.